Good morning and welcome to the second People's Health Briefing by Roots Community Health Center. Today is July 28th, 2020. I'm Dr. Abalada and Dr. Kenji Taylor is my co-host for today's briefing. As health professionals rooted in Oakland, serving some of the people who are most vulnerable to poor outcomes with COVID-19, we are here to cut through the noise and give you the information we think is most important for you to make the best decisions to keep yourself, your family, and your community as safe as possible. The goal of the People's Health Briefing, a component of the Trusted Voices campaign, is to empower you with our best knowledge and thinking in 15 minutes every Tuesday morning of every week and to answer your most pressing questions. So please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Now, we know that although this pandemic is global, the effects are very different depending on where you are. So we're here to give you up-to-date information about Oakland and East Oakland in particular. You may have heard that over the weekend, Alameda County surged past 10,000 cases. And some of you have asked, well, isn't this just because we're doing more testing? It is true that more testing is going on all over the county, and that's a good thing. And of course, the more we test, the more cases we identify. So it's important that we also look at the positivity rate. That is, of all the people tested, what proportion tested positive, not just the total number of positive cases. And once again, Oakland and especially East Oakland look much different than the rest of the county. So what we're looking at here is a positivity rate, and you can see that in Alameda County, we're at 4.96%. But in looking at our East Oakland zip codes, you can see that the percentage positive is much higher, more than triple in some zip codes. So as you can see here in the 94603, about 1 in every 6 people who've gotten tested have tested positive, and that's compared to about 1 in 20 people in the overall county. Now, many of you know that Roots Community Health Center is conducting COVID testing, where our team is working on the front lines of this health crisis. And what we're seeing is telling us more of the story. As you know, organization-wide, we have tested over 10,000 people. And from our testing site at 99th and East 14th alone, we've received over 6,000 results and counting, and over 750 positive results. The vast majority of those are Oakland residents. So you can see from our testing data here, which represents more than 750 positive tests, that our overall percentage positive rate is 13%. And we've been hovering between 12 and 14% for months now. When we drill down into our results, looking at the East Oakland zip codes, again, you can see disproportionality with the 94603 at 21% positive and the 94621 at 25% positive. So this is indicating a higher burden of this virus within our East Oakland zip codes. So there's more cases and some areas have high percentages. Some of you have asked, who cares about cases? Shouldn't we be more concerned about deaths? So far in Alameda County, thankfully, the number of deaths is still low at 178. All of those deaths are in people over 50 years of age. That is still 178 people that are no longer with us. But thankfully, that number is still low. And it's true that deaths don't change depending on how many people we test, so it is an indicator that we should be looking at. But one of the problems of focusing just on deaths is that they lag some time behind a positive case. So from the time of a positive test to the time of death and the time of the recording of that death, more than a month time could pass. So we can't really rely on death data because we can't afford to wait to see how bad it's going to be. Another problem with only looking at deaths is that it doesn't take into account what can be very lengthy hospitalizations, intubation, painful and complicated hospital courses. And not to mention potentially long-term effects of this virus, which we're just now beginning to understand. So one important indicator that we can look at is hospitalizations from COVID, because although hospitalization also does lag a little bit behind a positive test, it doesn't lag as far behind. But hospitalization as an indicator is also stable regardless of testing. So if COVID is going to take you to the hospital, it's going to take you to the hospital regardless of whether you've ever been tested or not. So we can see here in looking at Alameda County total COVID-19 hospitalizations over the past 3 months. You can see that in May, the highest bed count was 105 beds with people with COVID in them. In June, it was 116, and that was what we were calling our peak or our surge. But so far in July, we're still climbing, and the highest COVID bed count has been 201, and that is the highest since the very beginning of this pandemic. Our ICU beds are still looking pretty good, and that's great. We still have hospital capacity and we still have ICU capacity, and that is reassuring, but we can't relax too much. We should remember that our hospital leaders across the county have worked very hard to essentially empty out our hospitals, and that is both for safety purposes and distancing purposes, for protection of the staff, but also to make room for the unpredictable nature of the COVID pandemic. So while we've done a great job in Alameda County of flattening our curve, we've also prolonged it, and we're now starting to go into our spike at a time when we've also been in a shelter mode for months. People have been putting off surgeries. People have been avoiding taking care of their long-term medical problems. And if other parts of the country are any indication, we are concerned that we're going to start seeing increases in other causes for hospitalization, like heart attacks and strokes. So that is contributing to this unpredictable situation of an increase in COVID cases, an increase in COVID hospitalizations, and concerns over our hospital capacity. So the bottom line is that the virus is hitting Oakland harder than other parts of Alameda County, and it's hitting East Oakland even harder. That is our reality. So our question is, what are we going to do about that reality? For now, the best we can do is mask, distance, test, isolate, and contact trace. As I mentioned, all of the deaths in Alameda County have been in those over 50 years of age. As a community, we need to be most concerned about our population over 50 years of age. And as age increases, so does the risk of death or serious complications from COVID. If you are over 65 years old, I hope you're able to shelter in place. If others are coming around you, you should be wearing a mask and making sure that they are wearing one too. And now my co-host, Dr. Kenji Taylor, will get into more detail about masks.
Good morning, everyone. I'm Dr. Kenji Taylor, Director of Clinical Programs at Roots and faculty at Stanford. Dr. Noha, thank you for the opportunity to do one of my favorite things in medicine, myth busting. Each week, we will address some of the widespread myths about COVID and bust those myths with the best facts we know at the time. If there's information out there you want us to report on, you want to know if it's fact or fiction, submit your questions on Facebook, direct message us, or send us an email at admin@rootsclinic.org. This week's myth: face masks aren't necessary if you don't have symptoms. Face masks aren't safe. So we've been hearing lots of people say that wearing face masks are unnecessary or even harmful. This is a myth. Wearing masks, when combined with social distancing, are a key part of slowing the spread of COVID-19. Our national public health organization, the Centers for Disease Control, or CDC, recommends that everyone over the age of 2 wear a mask while in public settings. We at Roots stand firmly behind those recommendations and urge our community to mask up. But Dr. Kenji, I'm feeling fine, no symptoms. I shouldn't have to wear a mask, right? Myth. Masks are an important part of slowing the spread of disease. Research from around the world to our very own testing site at Roots here in East Oakland shows that at least half of the people who test positive don't have any symptoms. Research shows that countries that instituted widespread masking policies successfully slowed the transmission of COVID. That means most people don't even know they are spreading the virus when they talk, sneeze, sing, cough, or shout. And when people talk, sneeze, sing, cough, or shout without a mask, we run the risk of spreading the virus to other people through respiratory droplets. Bottom line, wear masks to protect others, and others should wear a mask to protect you, regardless of symptoms. But Dr. Kenji, I've heard that masks are actually dangerous to you because you're breathing in carbon dioxide, right? Myth. Wearing masks are safe. Healthcare providers have been wearing masks for extended periods of time for decades without any bad health outcomes. We know this is very safe and is definitely worth it for the benefit of not spreading COVID. Carbon dioxide, the substance in air that people worry is dangerous, will not build up wearing even the most protective masks because it moves freely through the mask when you exhale and inhale into it. Oxygen, the substance that we all live off of, also moves freely across the mask. So there's really no reason to believe that you aren't going to get enough of it. But Dr. Kenji, I have breathing issues, and I heard a mask is dangerous for me. There may be a very, very, very small group of people with severe lung disease, not mild asthma, where a mask can be more problematic. For example, people who require supplemental oxygen to breathe. If you're one of these people, you should talk to your doctor about what to do. However, if you have such severe lung disease, you should be avoiding the virus at all costs and be isolating. So really the need for a mask should be minimal. For everybody else, a mask is completely safe. Bottom line, wear a mask to protect others, and others should wear a mask to protect you. A lot of patients ask me, what are all those different types of masks and which one should I use? Great question. There are three main types of masks: surgical masks, N95 masks, and cloth masks. Surgical masks are disposable masks that filter our large particles from the air. No type of surgical mask is recommended over another. N95 masks provide more protection because they filter both large and small particles. As the name implies, they filter 95% of small particles. These are also disposable, but more and more are being reused to conserve supply. Healthcare providers are actually trained and pass a test of fit for these specific masks. Cloth masks are what I recommend for most people. They primarily keep the mask wearer from spreading the virus to other people. They can also be stylish and reflect your personal tastes. When used by the general public, they have been shown to reduce the spread of COVID. They can be made from lots of common materials like cotton that are tightly woven. They can also be purchased or even given away in mask drives. Using cloth masks helps conserve surgical and N95 masks. So a few parting pro tips. Wash your hands or sanitize them before putting on and when taking off your mask. If your mask becomes wet or dirty, switch to a new one. Find a mask that fits you well. Not all masks are constructed the same, and it may take a few trials before you find one that works for you. Finally, masks are not a substitute for social distancing, but can be an added layer of protection if you can't socially distance. I have some higher risk patients who live at home with others who are going out and about. I have them mask up even at home so they don't get COVID from others who are going out. And I also encourage those members of the household who are going out to mask up even at home. Bottom line for this week's Mythbusters: wear a mask even if you don't have symptoms. Masks are safe. Now back to Noha for some final words.
Thank you, Dr. Kenji, for that critical information. So here is some of our best advice one more time. If you are out there potentially getting exposed to COVID-19, either because you're an essential worker or you're taking risks like hanging out without masking or distancing, please make an extra effort to protect those who are at risk. Take an extra effort to protect those over 50 and those with underlying conditions. One of the best ways you can do this is don't go around them. And anytime you must go around them, please wear a mask. If you are their caregiver, you may need to get tested frequently, even up to once a week. And if you do not feel well, please make other arrangements for their care and do not go around them until you get tested and receive your results. Also remember that ventilation is one of our best tools, so please use it. This concludes today's health briefing. Please submit your questions in the comment section by direct message or email to admin@rootsclinic.org. Thank you for watching, and please join us again next Tuesday at 10 a.m. for the People's Health Briefing. Thank you. Do we want to do